Well, Dr. Joe's on board with us. He's been part of, speaking of numbers, he's been part of this morning show for over 25 years. And we bring him in on Wednesday mornings at this time. And let's bring him in. Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe.
Hey, Ray. Thanks for this beautiful morning and that nice intro. One of the things I want to talk about today is something that a lot goes by, the calls I get, and I'm still getting a lot of calls, and I have throughout my career, that a lot of people kind of confused with injuries to joint, particularly the knee joint, of the different types of cartilage. They're not sure exactly what their type of cartilage or cartilage injury might be and how we treat it. So I wanted to just cover briefly the difference between the two types of cartilage, particularly in the knee. We use the meniscus cartilage, and the meniscus cartilage is a C-shaped shock-absorbing pad or cushion that absorbs shock in the knee when we're running and cutting and playing sports, and it's a C-shape. The one on the outside is kind of a tight, like a lowercase C, and one on the inside is a bigger C. And these cartilage pads, sometimes when people twist or land awkwardly or cut awkwardly, they will tear that cartilage pad, and it doesn't heal well on its own. And so for years we said, and much of my career of 40 years, hey, when somebody tears that cartilage pad, they're probably going to need surgery. But things have changed like everything else a little in medicine. I wanted to review that with the meniscus cartilage. First of all, this injury doesn't occur as much in kids. This cartilage pad is very pliable and elastic in kids, so they don't tear it much, but they do sometimes with awkward twisting injuries. Sports like wrestling, where you're really bending and twisting the knee a lot, catchers used to be at risk because they're sitting in that bent knee position for a long time, and pivoting sports, but it much more so is in adults, and we can be doing yard work and tear that cartilage pad. And so used to always think, hey, it has to be treated with surgery, but like everything else, over the last 15 years or so, we've kind of done better with things like physical therapy, maybe as arthroscopic trimming of that cartilage pad, now even a very good repair that we've had in the last 15 or 20 years where they can repair with sutures smaller tears in that cartilage pad and not need to take out the majority of it. Gosh, early in my career, we would take out a lot of that cartilage pad. We wouldn't have that shock absorber. Could lead to arthritis later on and knee replacements and other things. So the key is, if you get these kinds of injuries, gosh, we got to get on them early and treat them early so we don't go all the way down the road to those knee replacements that we hear about later on. The other type of cartilage is called articular cartilage, and people are a little bit confused about the difference. The articular cartilage is this shiny, tough covering of the joint in the knee and other joints, and this lining cartilage gets bruised and torn and worn out over time, and you lose the coverage of that bone, and the bone will bleed and be painful, and it'll look like kind of craters on the moon when you look at this with an MRI, or later on when you look at it, when they look at it, my orthopedic friends orthopedically, and oh my gosh, after time, these craters on the moon wear out, and we get to what people tell us, oh, my gosh, my doctor said I'm bone on bone now. I don't have that shock-absorbing articular cartilage anymore. We used to do something in the 90s where we shaved it down. My orthopedic friends would shave it down, and it would look real good for 3 months or 6 months. But generally, that wear and tear came back, this craters on the moon part. And so the treatment's really, in the early stages, medicines because they're in a lot of pain. The key is physical therapy, and for some reason people just don't believe PT is going to help a lot. That is the number one thing that helps with both of these cartilage injuries early on, is doing aggressive physical therapy to stabilize the knee. But if we're too far along, people will use things like bracing. Later on, we'll use injections. We've gone through from a lot of cortisone injections to gel injections. Gel gives you back a little of that shock absorption. Gel injections in the last 15 years have worked pretty well. And now what's called regenerative therapy for certain people that can be helpful to them to regrow some protective cartilage in that area. But for most people that have a pretty badly worn out knee and they're bone on bone and they don't have much articular cartilage left, we talk about total knee replacement. And certainly you're in my age range, we know that that's a pretty common thing amongst friends of our age range. And so I'm here to tell you today the take-home point, and always has been with us, is the reason we're so important in pediatric sports medicine. We want to get on these knee injuries early on. Start the treatment early. Treat this non-operatively to avoid that bone-on-bone wearing out of the knee later on, and reduce the number of total knee replacements when people are in their 50s and 60s and 70s. And I think in a career now of 40 years, I think we've done a pretty good job. We're doing better. I think we have reduced the number of people, but there's still a lot of people that just the knee wears out. And our surgeons do a great job with partial knee replacements or full total knee replacements when those things are necessary. But the take-home point is be aggressive with the early-on treatment. Listen to physical therapy in the early stages is when it works. When it gets too late, we have surgeons that do a really good job with things like total knee replacements, and we know of friends that have gone through those things. But those are the two types of cartilage. Hopefully that helps a little with the confusion and the calls that I get at night between the difference of the meniscus cartilage and the articular cartilage. The articular cartilage, when it's worn out, we call it osteoarthritis or degenerative joint disease when they get close to needing those knee replacements. And that's really what I wanted to accomplish this morning, Ray.
Joe, let me ask you this. I know it's patient to patient, but in general, when we get there, and obviously we have a lot of folks listening to this show that are 60 plus, when we talk knee replacement, is that generally wear and tear, or is it genetics, or is it person to person? What do you normally see when we talk about knee replacement surgery?
All of those things, Ray. That's, again, you always finish with really good points. Is a lot of people, the way they're made, their knee is made, they're really a little bit of a setup early on for getting arthritis later on. And they really have to be good about paying attention to this, not overdoing it, listening to their body, and when they get down the road a little bit, they may have to change the things they do because they have a genetic component. The way they're born puts them at risk. For other people, it's that they have had significant bruising and twisting and tearing. Many of them really don't treat it very aggressively early on, and they just continue to beat up particularly that lining cartilage of the knee. And so it is definitely from overuse. It's definitely from acute injuries like torn cartilage, meniscus cartilage, and it's definitely from genetics. It's really a little bit from all three, Ray.
There you go. So each and every person a little bit differently. So the knee pain is not one size fits all. Make sure you get it checked out. Joe, great
Ray,
information.
One more thing.
Go ahead.
Can I indulge you for 1 second more? You know I have all these kids, 6 kids out there.
Yeah.
My last one, number 6, is graduating from medical school on Saturday morning.
Nice.
No more schooling for any of my 6 kids. So Saturday morning, Dominic's graduating from medical school. I just wanted to throw that in there.
Congratulations, my friend. Love that. Okay, thanks, Joe. We'll talk to you next week.
Thanks. Have a great week. Okay.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. As I mentioned, part of this morning show here on WAKR for over 25 years. And